Hi, I am Dr. Pravin Vyawahare. I am a practicing ophthalmologist in Amravati, Maharashtra. I am practicing in Amravati since last 23 years. My experience with Optiflex TRIO till date is extremely satisfactory. Since last few years, I am fortunate to implant around 150 plus Optiflex TRIO in all my patients. And for these lenses, like other multifocals, I need not to counsel for the night vision symptoms. I do not have to tell them about the glare and alloys. And patients are very satisfied. So to begin with, when we started putting a multifocal lenses, the patient used to come and complain us a lot about the glare, halos, waxy vision. But fortunately with this lens, the patients are extremely happy and extremely satisfied. Because of the trifocal lenses, these lenses uses a maximum amount of light energy, like almost 88% of light is used, only 10 to 12% of light is lost. And this lost light causes a lot of problem, and because the lost light is very less in these lenses, the night vision symptoms are less. When we talk about the uncorrected vision with this lens, the lens doesn't give much refractive surprises, and the uncorrected distance vision is almost 6x in almost more than 90-95% of the patient without correction, because the refractive surprise is not there. And the uncorrected intermediate and near vision is around N6 or N6 part, and it's a very satisfactory. The refractive stability with the Optiflex TRIO is good, and because the lenses remain stable over the post-op time, the ACD doesn't change as much, and the refractive stability is excellent. When I compare the Optiflex TRIO with other lenses, there is no doubt that the visual outcome with these lenses are excellent. What I like most about these lenses are they are glistening free, they doesn't shine. A lot of multinational companies lenses, patient complain of glistening, and that is not the issue with Optiflex TRIO. As in any multifocal lens, the inclusion or selection criteria are same with the Optiflex TRIO. But because the amount of glare and halos are less, so you can be more liberal while selecting the patient for the Optiflex TRIO.